the Art Museum today with Dr. Holohan. Part of the work in this course is a final where students will be selecting a piece from the Art Museum's collection that they feel best represents death notification. Death notification is probably one of the most difficult skills and experiences that healthcare providers will have in the medical setting. We're really using this undergraduate space so that students can begin to think about what is a patient exam, how do I look at the patient, how do I understand the patient's experience, but also what are different interpretations of what's happening. And so we're using these visual thinking strategies to not only better our observation and listening skills, our collaboration skills, but also how might we think about what it's like to do death notification in a healthcare setting. So students are selecting their works now, they're meeting their work for the first time and beginning to prepare for their final, where they'll be bringing out themes of healthcare communication and death notification, and they'll be using the art as a tool to help express their understandings and their knowledge around death notification.
I was originally inspired by this because nature is something that we can learn from through death. There's death all around nature. There's also life all around nature. When I was looking at this, I thought it was really interesting how much detail this half has and how much sketch and draft this one has. This one is very much there's lots of trees that have branches and leaves, and there are some that really don't. There are some that are on the ground. There are some that are stubs. That kind of reminded me of the hospital setting, and when you're on a floor and you all have different experiences, different diagnoses, different severities of your diagnoses that you're going through, but you're all living on the same land, your roots are all connected, we're all human. It's kind of that cohesiveness of nature, but we all work together.
Medical schools and healthcare profession schools are actually using these strategies to better promote observation, listening skills, perspective taking. And so the way in which the students are thinking around the art is very different than how they would be thinking about things if I had something up on a PowerPoint or if they were being tested on a book chapter. And so we're really kind of unlocking these new ways of thinking and processing, which really enhances their abilities and their skills for future in patient care and really critical incidents in people's lives, including end-of-life and death care.